Cerebral palsy. Cerebral palsy is a disability that affects more than 50,000 Canadians, including my brother and sister. So, what is CP? It is a disability that affects body movement and muscle coordination due to an injury to the developing brain. Basically, the injury interrupts a message going from your brain to your muscles. There are 3 different types of CP. The most common is spastic, which causes stiffness in the muscles, making it hard to move. The second type is athetoid, which causes uncontrolled muscle movements. And the third and least common type of CP is ataxic, which makes it hard to balance and have poor depth perception, which means they have troubles judging how close and how far away things are. There are many different causes for cerebral palsy, but the most common can include being born premature, having low birth weight, lack of oxygen, or multiple birth, which means twins or triplets. Cerebral palsy is not curable, but it doesn't get worse. It is also not contagious or hereditary. There are many different treatments available for CP, like occupational therapy, physical therapy, speech therapy, along with special equipment and surgery. Like I mentioned before, my twin brother and sister have CP. They were born 2.5 months premature, weighing 3 pounds 9 ounces and 2 pounds 15 ounces. They weren't breathing when they were born, so were put on machines to breathe for them and were taken to the NICU where they stayed for 6 weeks. Taylor has spastic quadriplegia, which it affects all 4 of his limbs. Ashlyn has spastic diplegia, which it only affects 2 of her limbs, which are her legs. They both wear splints to stretch out their leg muscles. My mom takes them to Scanner Rehab for physical and occupational therapy. They have some really cool toys and equipment there. They teach my mom what stretches and exercises to do with them. They also have special equipment too. Ashlyn used to use a walker, but no longer needs it. And Taylor has a wheelchair, a standing frame, and a walker. Someone with cerebral palsy may have to adapt to everyday activities, but that doesn't mean they aren't smart, can't be a good friend, or live a happy and healthy life. Remember to treat everyone you meet, whether they have a disability or not, the way you want to be treated.